Hi, I'm Patrick Borgen, Chairman of Surgery at Maimonides Medical Center in Brooklyn, New York, and Chairman of Miami Breast. I would like to personally invite you to attend the 39th Annual Miami Breast Cancer Conference. This 4-day, highly interactive educational event will take place March 3 through 6 at the spectacular Fontainebleau Hotel on historic Miami Beach. We are committed to providing you with a practice-focused, information-dense, interactive experience designed to help you integrate the latest, highest quality approaches to managing your patients with this complex disease. So join me and our world-renowned faculty as we discuss, explore, and debate advances in this rapidly changing field. Network with your colleagues and our faculty to bring the best possible evidence-based care to your patients. Our motto for nearly 4 decades has been, hear it on Friday, use it on Monday. I hope you can join us. I look forward to welcoming you to Miami. One of the themes that we will highlight this year is a continued exploration of the de-escalation of care for breast cancer. And this is really de-escalation across medical oncology, across surgical oncology, and radiation oncology. So questions like, how do we integrate the new RxPONDER trial data or monarch-E trial data into our practices to make sure that we are matching our treatments with the disease while ensuring the best possible outcome for our patients. We will explore emerging agents like PARP inhibitors. We'll talk about oral estrogen receptor downregulators that have caused a lot of enthusiasm. We'll talk about things like circulating tumor cells and how they might replace complete pathologic response in our patients. And of course, we will have our debates, medical crossfires, really looking at controversial issues from 2 different sides. So this is really what I think we're going to focus on Miami this year, plus your questions, your cases, and meeting you and discussing these things in person is incredibly important to our success. I would say for the last 25 years of my practice, I come back every year from Miami with a whole new set of ideas, a whole new set of questions, and I think a far better approach to our patients. Breast cancer has evolved tremendously over 4 decades, and our understanding of the disease has evolved. Miami allows us to look at breast cancer from every direction, from medical oncology, radiation oncology, genetics, genomics, surgery, and really put together a plan that's best for our patients. This is absolutely a meeting that will change your practice. I'm completely biased in that I believe that all of our topics are incredibly beneficial. But some of the themes that our audience will hear center around things like management of patients with HER2 positive breast cancer, not only in the early setting, but in the metastatic setting, where there has been an explosion of new agents, where sequencing of those agents is so vitally important. We'll be talking about checkpoint inhibitors and T-cell modulators, and how in the estrogen receptor positive subset of patients, those have changed the landscape of breast cancer. New drugs like PARP inhibitors will be discussed. From the surgical perspective, we'll be talking about exciting advances like reverse axillary mapping and de-escalation of surgery in the axilla. So really, this is an information-dense meeting. I think all of our topics are going to be exciting and interesting to our audience. If you have not attended Miami, I want to really share some things with you. This is a world-class faculty, hand chosen over the previous year, presenting their knowledge and information to you in a truly world-class conference facility on beautiful Miami Beach. Going back almost 40 years, we have used an ultra short format. No lecture is more than 15 minutes. Our speakers begin with their concluding slide. This is what I do in my practice and why. It is intensely practical. Almost every discussion is kicked off with a case thumbnail. Here's a case from your practice back home, and here's how we would address it, and here's how we would develop an evidence-based approach to your patient. So the meeting is in a beautiful setting on a beautiful beach, absolutely information dense. You will learn a tremendous amount across the 4 days of this meeting.